Hi, it's Kate French here, clinical psychologist. I'm filming this Friday live, not live today, just because the internet's being a little bit unstable. So I thought I would do a quick video for you anyway, and then hopefully post it up, no problems. So I actually wanted to talk to you a little bit today about a topic really close to my heart, which is autism. And many of you might already know that a lot of my work in side-by-side psychology is with families and children and teens who all recognise that autism is part of their story or part of their identity. So I wanted to talk a little bit today a bit about autism assessment. So diagnostic assessments is how I first really became involved with the working in the autism space, and that was because I was working in child and adolescent mental health, and for some reason the assessment purposes for autism also sit in the child and adolescent mental health in the public system. So that is where I first really started to get a really good understanding of the kinds of strengths and kinds of challenges people with autism have, and I went and did all my training in that kind of phase of early in my career. So I wanted to talk a little bit about how I've come to do autism assessments, and also a little bit about the national guidelines document that has been out for about 12 months now, and how that has sort of impacted or should be impacting on how assessment teams do their diagnostic assessments. So I'm going to take you a quick run through how I do mine and the components that you'll typically find in an autism assessment. So usually when I get a referral from a pediatrician or a child psychiatrist for children and teens, or if they're an adult diagnostic assessment, they can be self-referred, or maybe they come with a GP referral. So it's a different process a little bit between children and teens and adults. When they come in, what we usually get them to do is, with the parents and not with the children involved, I get a really thorough developmental assessment done. So I usually use what is called the Autism Diagnostic Interview Revised, and that is a really detailed look at the child's development from very early on, when there maybe was not much language, or when they were really showing some signs, but maybe not any signs then of having a condition called autism, what we know as autism. So that takes 2 to 3 hours to sort of develop and get all that information from preferably both carers or both providers of care, but sometimes it might only be one, and that's okay. So that's the first part of the assessment done, is getting a lot of the very detailed information about milestones, language, any concerns about motor development, sleep, toilet training. Then we go into a lot more detail about social and communication language skills, and also into special interests and any behaviours or sensory presentations as well. So also, as part of that initial developmental assessment, I'll be providing families with questionnaires and screening tools to help, I suppose, quantify some of the challenges or some of the differences that they might be noticing with their child or young person. So I regularly give them some checklists. There's one called the Social Responsiveness Scale, which is a really great one to use with parents and carers, as well as with schools. And for school-age children, we also send off questionnaires and things for the teachers. We invite, obviously, feedback. And if we need to, we'll go out and do an observation in the kindergarten or childcare or school. But often that's not necessary. Often we can glean an awful lot of information from the people who are observing the child or young person in their natural environment. The other big part of the autism assessment is actually doing the one-to-one child assessment. So that is typically a play or play session. It looks like a play session for the child, but it's actually a structured diagnostic assessment. And so the tool that I use for that is called the ADOS, which is the Autism Diagnostic Observation Schedule, and that is specifically looking for challenges with social communication and how they respond to a series of planned tasks and how they respond, I'm scoring that, and then that kind of gets normed, and again, it gives a really useful piece of information of their play skills, their language skills, their aversion to any sensory pressures or any sensory kind of aversions they might have, any of their repetitive behaviours that may become apparent in that play session, and gives me a really good picture about how they respond to me as an adult engaging with them in a play kind of manner. So it's a really important part of the assessment process, and so I really encourage that if you've ever had an autism assessment done and that part of it wasn't done, or you weren't sure whether there was going to be someone, sitting down and playing with your child in a very, very focused kind of manner, that really needs to be part of it. So once we've got sort of the adult's developmental history, we've also got information from school, childcare, kindergartens, depending on the age of the child, and we also have that individual assessment. We then bring together all the other questionnaires that have been completed and summarise that. So that's usually my part of the diagnostic assessment. So the psychology part of it is not the entirety of the autism assessment, not at all. It can sometimes be, but it's more likely to be as part of a full multidisciplinary developmental assessment. So in the past, what I've done is I've teamed up with a speech pathologist who's got experience in the autism area, occupational therapists that have that same sort of experience, but it can be other areas of professionals as well. Although in the national guidelines, it takes you through what are the expectations that we need to have for people doing diagnostic assessments in this sphere, because it is a very niche practice, and there is a lot of knowledge that needs to be had by that professional before you go around saying, I'm just going to be doing autism assessment. So there's a lot of assumed knowledge before you can be going on and doing that. So you really need to make sure that if you do have an assessment team already sort of in place, before you're thinking of getting an assessment done for your child or young person, that allied health professional does have experience in this area, or is getting mentoring or training from somebody who does. So just having a speech or language assessment done is not the same as a speech pathologist doing an assessment for an autism assessment of their speech and language. They're quite two different things, and one's going to tell you a lot, and one's going to maybe rule out a speech and language difficulty but not tell you about their social communication differences, or whether that is typical of an autism spectrum presentation. So definitely I work with other professionals before we come to a conclusion using the diagnostic criteria in the DSM-5, which is the Diagnostic and Statistical Manual number 5, or there's another manual called the ICD-10, which can also be used in Australia as well. So all the information gets compiled. The people involved in that assessment need to discuss and collaborate and go through the criteria together before making a recommendation about whether a child does have or does not have enough criteria present to meet a diagnosis of an autism spectrum disorder. The other aspect that has been added this last year since these new guidelines came out, which is really, really important, is looking at developmental and adaptive abilities and how they compare to same-age kids. So definitely that is coincided with the introduction of the NDIS, which is the National Disability Insurance Scheme, which for autism is very specific about which children, depending on which diagnosis, get automatic or likely automatic planning meetings versus children where they have to say and prove the level of their challenges before they will be accepted for a planning meeting, and then maybe develop some funding and some goals to go along with their plan. So for autism, it has been kind of split depending upon the needs and the presentation of the difficulties, I suppose, that they might have, whether they get that support down the track or whether they are not needing it or not. So one of these assessment tools that I have been using with more recent autism assessments, or with people who have been previously diagnosed but didn't have this as part of their assessment, is an adaptive behaviour assessment tool. So there's a number of them. The one I use is the Vineland, but there are other ones as well that are equally as good, and sometimes it's a bit of a preference about which one you want to use. So these adaptive behaviour behaviour scales or adaptive behaviour assessments look at strengths and weaknesses across daily living skills, communication, social skills, ability to kind of integrate and use the community, and it gives kind of really functional information, I suppose, about where your child's strengths and challenges are, and in terms of planning for the future, what kind of supports need to go where. So the other part that's been added into the guidelines for autism assessments, which hasn't been there in the past, a lot of it is very similar to what I've always been doing, but they've clarified about doing a strengths-based model. So that's really challenging, I think, in terms of where we often look at diagnosis as where you go through all the deficits, and that's why doing assessments with families can be really heart-wrenching and a really exhausting process, where it seems all we're talking about is where their child doesn't meet up and where they have all these deficits, as it were. So I really like that idea of adding in their strengths, and especially it fits beautifully with the way I actually work with families. So I'm really looking forward to how that's going to transpire as a strengths aspect to it, where their gifts and their differences can be seen in a really positive light. And I think that will help balance out some of the negative kind of feel that these diagnostic reports certainly can have. So that's something that I certainly will be integrating and adding into my future assessments, and it's something that I think is really important and fits much nicely with our understanding, as we get better at understanding what autism is, that can be kind of communicated clearly in a report that looks at both the challenges and where we need to put support in, but also about celebrating their strengths and their gifts. So that's just a little bit about, I suppose, how I do autism assessments, and a little bit about, I suppose, some of the changes that have likely are coming in with our new national guidelines being in place for a year now, and what that might look like over the future. So I just wanted to quickly show you. So it might be backwards, but it's the National Guidelines for Assessment and Diagnosis of Autism Spectrum Disorders in Australia, and that is put out by the Autism CRC. So you can hop onto their website and you can find, you can put your details in and get a copy of that if you want to get skilled up, or you want to make sure that your assessment team have that information, and that we go forward really trying to improve on how we do things for the future of our children. So thank you if you've watched to the end here. It was a bit of a lengthy one today, and I'll have this posted up quickly for you, and please pop any questions in and continue the conversation about how we support our autistic families and the individuals as well. So thanks for listening.